injectables or anything before, right?
No.
How old are you again?
47 in
47.
July.
Happy birthday.
Yeah.
I'll be 49 in June, end of June.
Okay.
So we're coming up on birthdays.
Okay.
So anyway, tell me what bothers you, and then we'll go over a little bit of details of why I think you need A, B, and C.
Okay. Well, I was just interested in kind of preventative maintenance because I don't feel like anything's really too bad just yet, but I don't want to let it go too far, and I don't want to do anything really aggressive for a long time.
Right.
So I thought I would go ahead and get started with this, and maybe it would postpone surgery or maybe keep me fresher, younger looking longer.
Sure, absolutely. What do you do for skin? Do you do anything for your skin right now?
All kinds of stuff.
Go ahead.
I mean, I write about spa blogging, so I get facials almost weekly.
Okay.
So I have a whole regimen, but I'm not doing any kind of doctor
Medical grade.
medical grade.
Medical grade skin.
But I am interested in that.
Good. Okay, so we'll talk about that as well.
Okay.
And what bothers you specifically on your face right now?
Well, a friend of mine pointed out that I have one line here, and it's like the guy who gave me my landscaping quote. He's like, "What about this patch of clover over here?" And he was trying to be competitive. And now I see that clover in my yard all the time, and because this lady pointed this out to me, I never noticed it.
Right.
But now I notice it every time I put on my makeup.
Sure, sure. Okay, well, let me go through my little spiel.
Okay.
And then we'll get to why I think you need A, B, and C, okay?
Okay.
So as we age, the bones in the face are shrinking. The fat in the face is tending to atrophy or go away. So what happens is as the bone and the fat start to shrink, think of that as the hanger for your clothing. The hanger keeps getting smaller, 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 and the clothing falls. In the brow, the proximal 1/3 of the face, the bony orbital rim tends to get smaller, and then the brow falls. So we do this and this and this to try to see and bring more light into the pictures. As we get older, it gets a little bit harder to get light into the picture because of the hooding of the brow. So in addition, as that happens lower, the bones here tend to shrink. The bones in the upper lip or jaw region and the lower jaw region tend to shrink. And we start to get nasolabial fold lines. We start to lose cheek volume. We get something called a nasal jugular trough here, etc. Lips tend to look smaller, etc. So when I look at you, I'm looking at all of those little zones, proximal third, middle third, and the distal third, and I'm trying to make them all match and look presentable and the best they can for your age. Now, let's talk about wrinkles, because when wrinkles happen from two different causes. There's dynamic over here in this little box. The dynamic wrinkles are those of action. Looking mean, concentrating, smiling, raising your eyebrows through expression. Those wrinkles can be treated with Botox. So Botox relaxes muscles of action, and I'm going to show you a picture of that in a second. And when it relaxes those muscles of action, you no longer can make that facial expression. The nice thing about Botox Cosmetic is that it's very selective. There are different products out in the market, and I only use Botox Cosmetic because it's so selective. Its area of dispersion is approximately 1 square centimeter. Some other products are approximately 3 square centimeters. So Botox can really isolate certain muscle groups and yet keep the other muscle groups active. So you can still do this, but you can't do this anymore. And I need my Botox. I need it right here. So when I get my Botox, I can't do that at all. But you can't tell because I can still make the other facial expressions, right?
Right.
So in your case, you have the classic signs here and here. You have 2 lines there, actually.
Oh.
And we call those the 11s. Botox Cosmetic runs an ad that actually says, which one are you? A 1, a 2, or a 3? So do you have 1 line, 2 lines, or 3 lines? And no matter which one you are, Botox tends to treat all 3 of those different categories.
Okay.
So we'll be able to relax muscles of action in the glabellar region right here. And I'll show you a picture again in a second. And what that will do, that'll last about 3 months. It takes about 14 days to kick in, and it'll last 3 months. If you don't like it, it'll wear off and you'll go back to baseline. If you do like it, unfortunately you have to repeat it at about every 3 months or once a quarter.
You mean I have to come back to the Greenbrier 3 or 4 times a year?
That's going to really kill you.
I know.
Yeah.
Twist my arm.
The Greenbrier is a great place. So that takes care of this area, right? Dynamic wrinkles. The other problem is that as we age, we get wrinkles of non-action or adynamic in this box over here. those wrinkles have to be treated with different things. One of the causes of that is a loss of volume. As you age, that face is shrinking. Number two is environmental pollutants, smoking, sun damage, whatever. You work in a smoggy city, whatever. Those take their toll on the face or the skin of the face as well. So those wrinkles need to be treated with chemical peels, microdermabrasion, non-invasive and invasive lasers, and or skincare.
Okay.
And that's what I was getting at before. And then finally, when you're losing volume and creating adynamic wrinkles or loss of volume in the face, those areas can be treated with fillers, Juvederm, Voluma, Sculptra, Radius. There's so many different product lines out there, okay? So when I look at you, the proximal 1/3, this does bother me a lot for you. The glabellar frown lines and the smile lines here. If I can relax this muscle group and this muscle group, those are the depressors of the face. They bring the brow down and in. It will allow this muscle group to take over, and you'll get a little brow lift. So on this, it's going to give you a little bit of a softer look, a little more rested, well-rested look, and hopefully a very natural look still as well. All right?
Good thing I booked. It sounds horrible.
Now, so let's talk about your skin for just a minute,
Okay.
because you actually have nice skin, but you have some sun damage.
Right.
Like we were talking earlier, you're a ginger, right?
I play golf.
And you play golf, and you're out in the sun, you have freckling, etc. You can't protect your skin near as well as somebody who has darker nationalities or darker skin types, right? So with that said, your skin tends to poop out. The melanocytes in the skin themselves kind of get fatigued, and they create freckling. And they also create fine lines and wrinkles. So through medical grade skincare, we can help reverse some of that and keep that from becoming worse as you get older. So it helps maintain your youth, maintain where you are at 40, what did you say, 46?
I'll be 47 at the end.
You'll be 47, okay. So at 46 years old, if I can make you keep your skin the same when you're 50, you look this way, you're going to look really good for your age, right? And that's the goal. And medical grade skincare products work a lot differently than something over the counter, from Lancome, Clinique, etc. They just don't have near the concentration of the good products, that they're good ingredients that you need in that product line versus medical grade skincare.
Okay.
What we use exclusively here is Skin Medica. Great line with a lot of research and development in its history, and it really does make a difference. You can see a noticeable difference in as much as...
I have facials with Skin Medica at different spas I've been to, so I'm familiar with the line.
Sure.
I just haven't started doing it at home yet.
Well, we're going to get you started on it, okay?
Okay.
So Skin Medica is a great line as well.
Okay.
Lastly, I want to show you some pictures.
Okay.
Sherry, come around here and let's let her, you can show the viewing audience some of these pictures. So this is the face, and when we are thinking about the muscle groups in the face, the first muscle group we're thinking about is a group of muscles right here that sit in here like this. And that's called the glabellar area, and that group of muscles tends to make those lines. It creates the 11s, the 1s, or the 3s, whatever you want to call it,
Sure.
by contracting. The muscles themselves are attached to the bone, and then they're also attached to the underside of the skin. And that's how we create such facial expression in our face as we move along.
Okay.
That area, and then this muscle around the eye, called the orbicularis oculi, this muscle tends to create wrinkles that are out here, crow's feet, and then we get wrinkles that are in here with this muscle. So if I can selectively treat those areas, let's say with Botox, here, 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 and here, and right there, there, and there, and there, there, and there, I can relax those muscles so they do not function as well. And then that'll allow this muscle, the frontalis muscle, whoops, let's go to this, the frontalis muscle, the elevator of the brow, to take over and give you nice expression, but a more rested, relaxed look, and allow your brow to lift up, which is what we want. It's a sign of youth,
Okay.
right? So that's what I plan for you today, is Botox here
Okay.
and around here. We call that a 2-site Botox, and it's going to take us just a few minutes to do, and you'll see results within as quickly as about 4 or 5 days, but usually by 10 to 14 days is when it maxes out.
Okay.
Does that sound good?
Great.
All right. I just want to get some pictures on you,
Okay.
and then we will move forward and do your treatment. Yeah. Come on over here and straddle the ones and face me. Okay. Straddle the fours and face this way. Okay. Straddle the threes and face that way. Chin down a little bit. Good.
As a blogger, we're always trying to have our chin up to look flattering.
Chin
We're shameless.
Now listen, I'm not saying that you need this, but there's another product, injectable product, again, non-invasive injectable product that treats this. Something called Kybella. And Kybella helps get rid of the fatty cells, the lipocytes, in the submental area. You get 2 to 3 treatments, and what it does is it dissolves that fat. And if you have good skin tone here, with somebody like you have good skin tone, you'll restore that angle under there and don't have a fat neck.
That's awesome.
Interesting.
Yeah.
A lot of the girls call that a turkey waddle, right?
Okay, yeah, we don't want it. I'm not going there.
Have a seat.
That is not happening for me ever.
All right, now time for the treatment.
Okay.
Are you nervous?
No.
Good.
Little squeezy balls helps distract you. And I'm going to give you a little bit of ice just to put on your forehead here. You can hold that if you like. It's actually staying pretty good. Okay, we're going to take this down. I'm just going to rest this right here. Clean your skin with a little alcohol, okay? All right, I'm going to walk you through each little pinch, okay?
Okay.
Okay, here we go. First pinch, 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 pinch. You having any pain?
No.
It's not bad, huh? Make your mean look for us. There you go. And raise your eyebrows up. Good. Perfect. We're going to get these little muscle groups here. Voila.
I did it. My
Botox
first time.
treatment. All done.
First of many, I guess. Welcome to the world of Botox.
Hopefully so.
Are we getting some good questions from viewers? Can you see it? Okay.
You can hold your ice there for just a second. You really don't need it long.
Okay.
And you're done.
And then what are my expectations for the rest of the day? I think I have a spa services scheduled.
Yes, okay. So normally we ask you not to lay down or exercise for the first 45 minutes to an hour after the treatment. After that, you can certainly get moving again. And when I say that, you could go to the gym and do some things. To be honest with you, I've had Botox at 12 o'clock noon and gone for a 30-minute run at 12:15 and been fine. So, but some people worry that if you lay down flat or on your face right after the procedure, that the Botox can move a little bit and you can get into an adjacent muscle group. I've never seen that happen. The worst side effect that you may feel or see is a little bit of a headache the first half hour or 45 minutes. It's not so much that it's the Botox, It's really the fact that I put a needle in there and put something in, a fluid. It could be saline. And that different change in pressure there makes you feel a little bit off.
So you never had to treat a patient that had some kind of weird adverse reaction to
I've never, knock on wood, I've never had an adverse reaction. Botox is the #1 injected cosmeceutical worldwide, hands down. It's been around since 1989.
You've been injecting it since how long?
Well, the product's been around since '89. I myself have been injecting Botox since about '96.
Okay.
And it officially went on label to be able to, FDA approval, to be able to do the glabella area, and I think it was 2002.
Okay.
And since then they've gotten FDA approval for the crow's feet as well.
Okay.
So that's the primary site of use. There are off-label uses as well. We can treat the muscles here that create downward turning of the what we call the lateral oral commissures, or the lateral mouth. We can also treat people who get the bands here, the platysmal banding, and it relaxes those muscles. So it's really, it's a very diverse product with a lot of different uses for it, and it works quite well. And the nice thing is, it's very predictable. At 3 months, you got to retreat it.
Okay.
So.
I guess we can go ahead and reschedule then.
Yeah, let's reschedule. That wasn't bad, right?
No, actually,
Okay.
I didn't need these at all.
You need the squeezy balls here. I'll take them.
I was a big girl, right?
Yeah, you did a great job.
Get a sticker.
Yeah, you get a sticker. So normally I have patients come back at 10 to 14 days just to check up on them.
Okay.
And if there's any problems or asymmetries or issues, we can always touch those up right at that time with a little bit of Botox.
Well, I understand that you do rounds in the hotel.
I do that.
That's so cool.
So it's interesting. Our patients come and have surgery here, not just Botox,
Yeah.
but that we have a surgical suite, an ambulatory surgery center. They come, they have surgery. We discharge them from the ambulatory surgery center. They get their own room in the hotel, and then I come see them every day at the hotel as they convalesce. Not a better place.
Not a better place.
I don't think in the country to convalesce, right?
It's gorgeous up here, especially this time of year.
Yeah.
Absolutely beautiful.
It's beautiful here in the winter too.
Oh,
It really
man.
is.
Gorgeous.
So yeah, we walk right out the door and I go see patients. We have dedicated rooms. The rooms have recliners in them. They have extra refrigerators. They have, so we have one room with extra double beds so that a family member can stay with you. It's
That's
really nice.
amazing.
And get room service, the whole 9 yards.
I love it.
Yeah.
That's awesome. That's something to look forward to if we're going to go there.
Why not, right?
Well, I mean, it's not covered by insurance, so it seems reasonable that you would get the best person to give it to you at the best place, because doesn't cost anything more really besides just staying at the hotel.
Right.
So it's not like you're charging an exorbitant amount. You're charging the same as other doctors that perform this other places.
No,
so.
absolutely. Our prices are very competitive throughout the country, through national averages. Absolutely.
Right.
And the hotel prices, you do get a discounted rate at the hotel when you have surgery with us here.
Okay.
So that's a big deal, because people think, oh, I don't want to spend, I don't know, $500 a night on a room. Well, you're really not spending that. It's very competitive, and there are a lot of guys throughout the country who patients come to visit and see their plastic surgeon and have surgery. Well, many times they'll stay at the Hampton or the Holiday Inn, and we've tried to become very competitive with those other hotels with our pricing, so patients can come here and convalesce in the tranquility of America's resort.
And get world-class medical treatment.
And world-class medical care.
Thank you very much, Dr. Kluska.
You're more than welcome. Hopefully we'll see you back more.
Yeah.
Next I'm going to have one of my girls talk to you about skincare.
Excellent.
And from there, hopefully we'll get you back in the chair for your Botox again.
Nice, long, healthy relationship. You're not going to let me go downhill, are you?
No.
Okay, great.
We'll keep you looking good.
Okay, thank you very much.
Nice to
I
meet you.
appreciate it.
All right, thanks.
You're welcome.
There you go. We get any questions? Any hits?